Welcome to today's educational guide on fetal gender determination using ultrasound. Whether you're an expectant parent, a medical student, or a sonography trainee, this video will walk you through the science, techniques, and limitations of identifying a baby's sex on ultrasound, accurately, ethically, and safely. Let's begin with the basics. Ultrasound or sonography uses high-frequency sound waves to create real-time images of the fetus inside the uterus. Unlike X-rays, it involves no ionizing radiation, making it the gold standard for prenatal imaging. The American College of Obstetricians and Gynecologists, ACOG, and the International Society of Ultrasound in Obstetrics and Gynecology, ISUOG, both endorse ultrasound for fetal assessment, starting as early as 6 weeks, though gender determination is rarely reliable before 14 weeks. Now, the key question: when can we accurately determine fetal sex? The answer depends on gestational age, fetal position, and amniotic fluid volume. The earliest reliable window begins at 14 weeks, but the gold standard for accuracy, over 95%, is between 18 and 22 weeks during the second trimester anatomy scan. Before 14 weeks, the genital tubercle is undifferentiated in both sexes. By 12 to 13 weeks, it begins to angle differently, upward in males, forming the penis, and downward in females, forming the clitoris. However, even at 13 weeks, accuracy is only about 80–85%, and errors are common due to cord shadows or limb overlap. The nub theory is not evidence-based. While some online communities swear by the angle of the genital tubercle at 11 to 13 weeks, peer-reviewed studies in ultrasound in obstetrics and gynecology, 2014, show it has a positive predictive value of only 70–80% at best. It should never be used for clinical decision-making or parental counseling. Let's look at the anatomy. In a male fetus, you'll see 1. The penis as a protruding structure with a rounded tip, the glans. 2. The scrotum as a bifid structure below, often containing visible testes after 20 weeks. 3. The turtle sign. The penis tip with scrotum resembling a turtle head and shell. In sagittal view, the phallus points cranially, toward the head. In a female fetus, you'll see the labia majora as 3 parallel lines, the hamburger sign. 2. The clitoris as a small midline structure, often less prominent. 3. The phallus points caudally toward the feet. No scrotal sac or midline penile shaft. A common misconception is to predict fetal gender based on following parameters. Fetal heart rate is not a reliable indicator for gender prediction. A common myth debunked. Placental location. A centrally located placenta has no correlation with fetal gender. The so-called Ramsey theory is non-scientific and lacks clinical relevance. Amniotic fluid index. Scanty amount can reduce visibility. Now let's address academic misconceptions. Some claim 100% accuracy at 16 weeks. This is false. A 2015 meta-analysis in obstetrics and gynecology reported 16 weeks, 191% accuracy, 18 to 20 weeks, 97%, after 22 weeks, 99% if visualized. Another error: confusing hypospadias with female genitalia. Hypospadias sonographic signs include a small penis, the tulip sign, a blunted bulbous tip, and an interrupted or abnormally positioned urethra. Always confirm in multiple planes: sagittal, axial, and coronal. What about 3D ultrasound? It can enhance visualization, especially in obese patients or with low fluid, but it's not more accurate than 2D for gender. Ethical considerations. In some countries, gender determination is restricted due to sex-selective practices. In the U.S., ACOG advises against non-medical gender reveal parties before 18 weeks due to error risk and emotional impact of misdiagnosis. In summary, Fetal gender determination is a skill that combines anatomy, timing, and caution. Wait until at least 18 weeks, use multiple views, and never rely on myths or early nubs. For parents, enjoy the journey. The real magic isn't boy or girl, but a healthy baby. Thank you for watching. Like, subscribe, and comment your questions below.